The Great Start Collaborative of Marquette and Alger counties welcomes you to a 5-star bus tour across 2 counties as we explore the investment we've made in our children. According to the Wilder Foundation, school success is a critical issue for our nation and especially Michigan. Without children prepared for success, Michigan will lack the education and skilled workforce required for economic competitiveness and growth. And it all begins from day one of a child's life. In the first year, a child develops superhighways of neural networks that begin the foundation of future learning. By age 2, a child's capacity to control his or her emotions and make social attachments are developed. By 3, a major part of a child's capacity for language and vocabulary is developed. And by age 5, 85% of brain development has occurred. Because of this, the Great Start focuses on the factors that impact these critical years. Let's give Michigan's children a great start in life. All aboard, the bus is on its way to a promising future as we take a 5-star tour of the Marquette Alger Great Start Collaborative. There are 5 areas of community support shown by each point on the Great Start Star. For each of these points, a team of committed individuals form a subcommittee to review relevant statistics and work to coordinate projects and services across agencies to better meet the needs of families and young children. Let's stop in with our first group for an update on pediatric and family health.
We're working on several issues. One of the first ones is we developed a memorandum of understanding between organizations that have a stake in trying to help mothers quit smoking. And that was collaborative between the UP Health Plan, Marquette General Hospital's Cancer Center, the Health Department, and the LMAS Health Department. One of the first things that we had to do was to develop a smoking cessation referral system. And what that is anytime a client goes in to see a health professional, be it a doctor or a health clinic, could even be one of our partners such as Head Start, and they identify folks who are pregnant or a young mother who may want to quit smoking, and so this cessation plan will help do that. The other thing that we're doing is developing an expectant mother's quit kit, smoking cessation quit kit. The state provided for a number of years these cessation tools, but unfortunately with economics they're no longer able to print those out. So we're developing our own local tool, which will be good that people will be able to get the local resources. Also, we're developing a cessation tool program in which folks who smoke through the use of a carbon monoxide tester actually see that they're breathing in carbon monoxide and it's staying on in their blood system instead of oxygen. And so that's very important for expectant mothers. It's another reason to help them quit smoking.
When looking at the statistic that about 20% of children referred to early on are toxic drug exposed, the subcommittee collaborated to bring a local training called Understanding Addiction, which is going to look at toxic drug exposure. We were able to bring in a doctor who is an addictionologist and then also the head of the behavioral care unit at our local hospital. The training was held May 24th and it was filled to capacity with over 100 attendees coming. And as a result, we're going to start looking at additional trainings based on the needs of all the participants that were at the training.
In addition to some of the more focused things our committee has been concerned with, we're also concerned with removing barriers to healthcare. In this regard, we've reviewed a transportation survey that was conducted a couple of years ago, and also have reviewed some more recent surveys looking at agency concerns, transportation industry, and parents.
Amy and I will take advantage of Healthy Kids, My Child, and Plan First and Mom State Insurance Training. And we will be able to enroll children and moms for state-sponsored health insurance at some of the events going on in the 2-county area.
Every child needs a warm, nurturing, and stable relationship with loving caregivers in order to grow to be trusting, curious, and confident. Children who get along with peers listen and respond to adults and demonstrate an eagerness for learning and are more likely to have success in school. Which is why our next stop is the Social and Emotional Health Subcommittee. They are
developing a multimedia campaign that's focusing on the 5 risk factors for early childhood development and helping to get the message out to the communities of Marquette County and Alger County to let them know the importance of early childhood development and some of the resources that could be available to them in order to assist them in it.
This multimedia campaign will cover all 5 protective factors for strengthening families. Nurturing and attachment. Building a close bond helps parents better understand, respond to, and communicate with their children. Knowledge of parenting and of child and youth development. Parents learn what to look for at each age and how to help their children reach their full potential. Parental resilience. Recognizing the signs of stress and enhancing problem-solving skills can help parents to build their capacity to cope. Social connections. Parents with an extensive network of family, friends, and neighbors have better support in times of need. Concrete supports for parents. Caregivers with access to financial, housing, and other concrete resources and services that help them meet their basic needs can better attend to their role as parents. Strong families start with strong parents. Let's visit with the Parenting Leadership Group.
The Marquette Alger Parent Coalition is a core group of parents that bring the parent voice to the table at the Great Start collaborative meetings so that the agencies and service providers who work with families with young children can hear directly from parents with young children and tailor their programs to best meet the needs of the families in our communities. We've had booths at local events to provide information to parents and also to bring more parents into our parenting leadership program. In 2011, we had booths at Kaleidoscope, Community Connect, and our Community Baby Shower to provide information on what the Great Start Collaborative is, what the parenting leadership part of that is, and how parents can get involved in this process. We have also created a permanent display of parenting resources at the Upper Peninsula Children's Museum. This includes books, videotapes, and brochures talking about the different programs and services available in the community. We have also partnered with Great Parents, Great Start on a teen parenting program this year and are looking toward developing a fatherhood initiative next year.
With the demands of today's working world, many young children are cared for by someone other than one of their parents. Our next stop, Childcare and Early Education, helps families gain access to high-quality early care.
One of the things that we've done is a written description of the types of childcare that are available in our area. That's been handed out to parents at local screenings and available on the Great Start Regional Resource Center website.
We wrote a grant, received $100,000, and now we're trying to make the community match so that we can provide high-quality early learning experiences for 3-year-olds in the community for the next year.
So we gathered we made it available to all providers in our region to find out what barriers there were regarding licensing. We met 4 times with providers. We came up with a list of about 20 barriers that they felt were pertinent. After sitting down with Deborah Clark, we were able to come up with a plan, and that will be shared with providers and hopefully bridge that gap between provider and consultant.
Which brings us to our final stop across the 5-point Great Start Star, family support. According to Child Trends Databank, very young children living in poverty are much less likely to recognize letters of the alphabet, count to 20 or higher, write their name, read, or pretend to read. Research shows that once a child falls behind in these basic skills, it is difficult or even impossible to catch up. The mission of the Family Support Subcommittee is to increase access for families to services and supports that meet basic needs.
One of the objectives that we dealt with earlier this year was related to assisting families with meeting their transportation needs. So the first thing we did was we developed a survey. The surveys were developed and went out to local agencies, organizations, parents who were looking for assistance, and also the transportation industry. That was completed in May. We've compiled the results, and now we're looking at how to deal with the barriers and eliminate them.
One of our other objectives was to pilot a family advocacy program, and the Navigator program kind of grew out of that. It was originally kind of started by DHS, and now the UP Poverty Initiative has taken it over. And the Navigator program pairs members of the community who are in need of help, who are kind of at risk of staying in poverty, and they are known as our neighbors, and you match a neighbor with a navigator.
And one other objective that we were working on is increasing high school graduation rates especially for parents with young children. And so one thing that we did was did some looking at the AMCAP information that they had related to GED testing, and we wrote up a brochure that's in some of the different areas and at events and how parents can go through getting their GED.
Together we can give a great start for every child in Alger and Marquette County. Keep them safe, healthy, and eager to succeed in their education and in life. Thank you for joining us on our tour of the Marquette Alger Great Start Collaborative.